Narcissism mental illness. 1. Introduction. Narcissism, a term derived from the Greek myth of Narcissus, refers to a personality trait characterized by an inflated sense of self-importance, a deep need for excessive attention and admiration, and a lack of empathy for others. While a certain degree of narcissism can be considered normal and even beneficial in moderate amounts, pathological narcissism, known as narcissistic personality disorder, NPD, is a mental illness that can cause significant impairment in an individual's life. The American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, DSM-5, classifies NPD as a cluster B personality disorder, marked by dramatic, overly emotional, or unpredictable thinking or behavior. Understanding narcissism as a mental illness is crucial for several reasons. Firstly, NPD is associated with a range of detrimental effects on both the individual and those around them, including strained relationships, occupational difficulties, and mental health issues. Secondly, societal awareness and accurate diagnosis are essential for providing effective treatment and support for individuals with NPD. Finally, exploring the nuances of NPD can help dispel common misconceptions and reduce the stigma associated with the disorder. This paper aims to provide a comprehensive overview of NPD, encompassing its historical background, defining characteristics, theoretical perspectives, etiology, diagnosis, comorbidities, impacts, treatment approaches, case studies, current research, societal perceptions, and future directions. Through this detailed exploration, we seek to enhance understanding and foster a more informed and empathetic approach to NPD. 2. Historical background. The concept of narcissism has a long history, dating back to ancient Greek mythology. The story of Narcissus, a beautiful young man who fell in love with his reflection in a pool of water, serves as a metaphor for self-obsession and vanity. This myth has profoundly influenced the understanding of narcissism in both literature and psychology. In the realm of psychology, narcissism first gained significant attention in the early 20th century with the work of Sigmund Freud. Freud initially considered narcissism a normal part of human development, referring to it as primary narcissism, a stage in which an infant's libido is invested in the self. However, Freud later recognized pathological forms of narcissism, which he described in his 1914 paper on Narcissism, An Introduction. Freud's work laid the foundation for subsequent psychoanalytic theories, which further explored the distinctions between healthy and pathological narcissism. Heinz Kohut and Otto Kernberg, prominent figures in psychoanalytic theory, made significant contributions to the understanding of narcissism. Kohut's self-psychology theory emphasized the role of developmental deficits in parental empathy, leading to a fragmented self and pathological narcissism. Kernberg, on the other hand, focused on the interplay between narcissism and aggression, proposing that pathological narcissism results from early object relations and internalized aggressive drives. The recognition of narcissistic traits as part of a broader personality disorder spectrum emerged in the mid-20th century. The American Psychiatric Association included narcissistic personality disorder in the DSM-3 in 1980, acknowledging it as a distinct personality disorder. The classification and criteria for NPD have since evolved, reflecting ongoing research and clinical observations. 3. Defining narcissistic personality disorder, NPD. Narcissistic personality disorder is defined by the DSM-5 as a pervasive pattern of grandiosity, in fantasy or behavior, a constant need for admiration, and a lack of empathy, beginning by early adulthood and present in various contexts. To diagnose NPD, at least 5 of the following criteria must be met. A grandiose sense of self-importance, e.g., exaggerates achievements and talents, expects to be recognized as superior without commensurate achievements. Preoccupation with fantasies of unlimited success, power, brilliance, beauty, or ideal love. Belief that one is special and unique and can only be understood by, or should associate with, other special or high-status people or institutions. Requires excessive admiration. A sense of entitlement, i.e., unreasonable expectations of especially favorable treatment or automatic compliance with one's expectations. Interpersonally exploitative behavior, i.e., takes advantage of others to achieve their own ends. Lack of empathy, i.e., unwilling to recognize or identify with the feelings and needs of others. Envy of others or belief that others are envious of them. arrogant, haughty behaviors or attitudes. NPD can be further categorized into two primary subtypes, grandiose and vulnerable. Grandiose narcissists exhibit overt arrogance, entitlement, and a blatant need for admiration. They often appear confident and assertive, seeking attention and validation through their achievements and status. Vulnerable narcissists, on the other hand, display defensiveness, hypersensitivity to criticism, and underlying insecurities. They may alternate between feelings of superiority and inferiority, often masking their vulnerabilities with defensive behaviors. The distinction between these subtypes highlights the complexity and variability of NPD, underscoring the need for individualized approaches to diagnosis and treatment. 4. Theoretical perspectives. The understanding of NPD is enriched by various theoretical perspectives, each offering unique insights into its development and maintenance. Psychoanalytic theories. Sigmund Freud's initial exploration of narcissism laid the groundwork for psychoanalytic theories. Freud viewed narcissism as a normal stage of development, with primary narcissism being an infant's self-focused state. However, pathological narcissism, or secondary narcissism, arises when self-love becomes excessive and maladaptive. Heinz Kohut's self-psychology theory emphasized the role of empathic failures by caregivers, leading to a fragmented self and pathological narcissism. Otto Kernberg's object relations theory linked narcissism to early object relations and internalized aggressive drives, suggesting that pathological narcissism results from unresolved conflicts and deficits in early relationships. Cognitive behavioral theories. Cognitive behavioral theories focus on the role of dysfunctional thought patterns and behaviors in the development and maintenance of NPD. Narcissists may have cognitive distortions that inflate their self-image and devalue others. These distorted beliefs can lead to maladaptive behaviors, such as seeking excessive admiration and exploiting others for personal gain. Cognitive behavioral therapy, CBT, aims to identify and challenge these dysfunctional thought patterns, helping individuals develop healthier cognitive and behavioral strategies. Social and cultural perspectives. Sociocultural theories highlight the role of societal values and norms in shaping narcissistic traits. The rise of individualism, consumerism, and the emphasis on self-promotion and success in modern society may contribute to the development of narcissistic traits. The influence of social media, with its focus on self-presentation and validation through likes and followers, has been implicated in exacerbating narcissistic tendencies. Understanding the cultural context is essential for comprehending the prevalence and expression of narcissism in different societies. Evolutionary psychology view. From an evolutionary perspective, certain narcissistic traits may have evolved as adaptive strategies for survival and reproduction. Traits such as dominance, attractiveness, and confidence can enhance an individual's ability to compete for resources and mates. However, when these traits become excessive and maladaptive, they can lead to interpersonal difficulties and negative social consequences. Evolutionary psychology provides a framework for understanding the potential adaptive and maladaptive aspects of narcissism. 5. Etiology of NPD. The development of NPD is multifactorial, involving genetic, environmental, and neurobiological factors. Genetic factors. Twin studies suggest a hereditary component to narcissistic traits, indicating that genetics play a role in the predisposition to NPD. While specific genes associated with NPD have not been conclusively identified, research suggests that genetic factors contribute to the development of personality traits related to narcissism, such as extroversion and low agreeableness. Environmental influences, parenting styles, and early life experiences significantly impact the development of NPD. Overvaluation by parents, where children are excessively praised and given unrealistic feedback about their abilities and importance, can foster narcissistic traits. Conversely, neglectful or abusive parenting can lead to feelings of inadequacy and compensatory grandiosity. Early trauma, inconsistent caregiving, and lack of realistic feedback during formative years contribute to the development of pathological narcissism. Neurobiological underpinnings. Neuroimaging studies have indicated structural and functional abnormalities in brain regions related to empathy, self-regulation, and social cognition in individuals with NPD. For instance, reduced gray matter volume in the prefrontal cortex and altered connectivity in the default mode network have been observed in individuals with narcissistic traits. These neurobiological findings suggest that abnormalities in brain functioning contribute to the cognitive and emotional deficits associated with NPD. Interaction of genetic and environmental factors. The interplay between inherited predispositions and environmental influences is crucial in shaping the narcissistic personality. Genetic factors may create a vulnerability to developing narcissistic traits, while environmental factors, such as parenting styles and early experiences, shape the expression and severity of these traits. This interaction highlights the complexity of NPD and the need for a comprehensive understanding of its etiology. 6. Diagnosis of NPD. Diagnosing NPD involves a thorough clinical assessment, considering both the DSM-5 criteria and the broader context of the individual's life and behavior. Diagnostic criteria. The DSM-5 criteria provide a framework for identifying NPD, emphasizing the need for a pervasive pattern of grandiosity, need for admiration, and lack of empathy. Clinicians must assess the presence and severity of these traits across different contexts and over time. The diagnosis requires that these traits cause significant impairment in social, occupational, or other important areas of functioning. Differential diagnosis. NPD must be differentiated from other personality disorders and mental health conditions that may present with similar features. For example, borderline personality disorder, BPD, shares some overlapping traits, such as unstable relationships and emotional dysregulation, but differs in its underlying mechanisms and treatment approaches. Antisocial personality disorder, ASPD, and histrionic personality disorder, HPD, also share certain characteristics with NPD, necessitating careful differential diagnosis to ensure accurate identification and treatment. Assessment tools and methods. Structured interviews, self-report questionnaires, and clinical observations are commonly used tools in the assessment of NPD. The Narcissistic Personality Inventory, NPI, is one widely used self-report measure that assesses various dimensions of narcissism. Clinicians may also use diagnostic interviews, such as the structured clinical interview for DSM-5 personality disorders, SCID-5PD, to systematically evaluate the presence of NPD criteria. A comprehensive assessment includes gathering information from multiple sources, including the individual's self-report, collateral information from family and friends, and clinical observations. 7. Comorbidities and complications. NPD is often accompanied by other mental health disorders, which can complicate diagnosis and treatment. Common comorbid disorders, depression, anxiety disorders, substance abuse, and eating disorders frequently co-occur with NPD. Individuals with NPD may experience depressive episodes when their grandiose self-image is challenged or when they encounter failures and setbacks. Anxiety disorders, including social anxiety and generalized anxiety disorder, can arise from the constant need for validation and fear of criticism. Substance abuse may be used as a coping mechanism to deal with emotional pain and to enhance feelings of grandiosity. Eating disorders, such as anorexia nervosa and bulimia nervosa, may be linked to the preoccupation with physical appearance and self-worth. Impact on physical health. Chronic stress, unhealthy behaviors, and strained relationships can negatively affect the physical health of individuals with NPD. High levels of stress and emotional turmoil can contribute to conditions such as cardiovascular disease, hypertension, and immune system dysfunction. Unhealthy behaviors, such as substance abuse, poor diet, and lack of exercise, can further exacerbate physical health problems. Additionally, the strain of maintaining a grandiose self-image and dealing with interpersonal conflicts can lead to sleep disturbances and other stress-related health issues. Legal and ethical issues. Narcissistic traits can lead to unethical behavior, legal problems, and challenges in therapeutic settings. Individuals with NPD may engage in manipulative and exploitative behaviors, leading to conflicts with the law and ethical violations in professional settings. In therapeutic settings, narcissistic clients may resist acknowledging their problems, manipulate the therapist, or disengage from treatment when confronted with challenging feedback. These legal and ethical issues highlight the importance of careful assessment and management of NPD to mitigate potential harm. 8. Narcissism in different contexts. The manifestation of narcissism varies across different contexts, influencing relationships, workplaces, cultural expressions, and digital interactions. Narcissism in relationships. Narcissists often have tumultuous relationships characterized by manipulation, lack of empathy, and an excessive need for control and admiration. Partners and family members may experience emotional abuse, neglect, and exploitation. The narcissist's need for admiration and validation can lead to cycles of idealization and devaluation, causing significant emotional distress for their loved ones. Understanding the dynamics of narcissistic relationships is crucial for providing support and interventions for both the narcissist and their partners. Workplace narcissism. In professional settings, narcissism can lead to both success and conflict. Narcissists often seek positions of power and authority, leveraging their confidence and charisma to achieve career success. However, their exploitative and manipulative behaviors can create toxic work environments, leading to conflicts with colleagues, unethical behavior, and high turnover rates. Balancing the potential benefits and drawbacks of narcissistic traits in the workplace requires careful management and organizational strategies. Cultural variations and influences. Cultural norms and values influence the expression and prevalence of narcissistic traits. Individualistic cultures, which emphasize personal achievement, self-promotion, and individual rights, may foster higher levels of narcissism compared to collectivist cultures, which prioritize group harmony, interdependence, and communal values. Understanding these cultural variations is essential for developing culturally sensitive approaches to assessing and treating NPD. Narcissism in the digital age. The rise of social media has provided a platform for narcissistic behavior, with the constant need for validation and self-promotion exacerbating narcissistic tendencies. Social media platforms encourage the cultivation of curated self-images, leading to increased focus on external validation through likes, comments, and followers. The digital age has amplified the opportunities for narcissistic expression, making it more important than ever to understand the impact of technology on narcissistic behavior. 9. Impact of NPD. NPD has far-reaching impacts on interpersonal relationships, societal functioning, and individual life outcomes. Effects on interpersonal relationships. Relationships with narcissists are often marked by manipulation, emotional abuse, and instability. The lack of empathy and excessive need for control and admiration can lead to significant emotional distress for partners, family members, and friends. These relationships may involve cycles of idealization and devaluation, leaving loved ones feeling confused, hurt, and unappreciated. Providing support and interventions for individuals in relationships with narcissists is crucial for mitigating the negative impact on their emotional well-being. Societal and occupational impacts. Narcissism can contribute to toxic work environments, unethical behavior, and leadership challenges. Narcissistic individuals in positions of power may prioritize their own interests over the well-being of others, leading to conflicts, decreased morale, and high turnover rates. However, certain narcissistic traits, such as confidence and charisma, can also lead to career success and influence. Understanding the balance between these potential benefits and drawbacks is essential for managing narcissistic traits in occupational settings. Long-term prognosis and life outcomes. The long-term outlook for individuals with NPD varies. While some may achieve success and maintain functional relationships, others may face chronic interpersonal and occupational difficulties, and comorbid mental health issues. The prognosis depends on various factors, including the severity of narcissistic traits, the presence of comorbid conditions, the individual's willingness to engage in treatment, and the support systems available. Long-term interventions and support are often necessary to improve the life outcomes for individuals with NPD. 10. Treatment approaches. Treating NPD presents unique challenges, requiring a tailored and comprehensive approach. Psychotherapeutic interventions. Cognitive behavioral therapy, CBT, psychodynamic therapy, and schema therapy are commonly used approaches. CBT aims to address dysfunctional thought patterns, improve emotional regulation, and develop healthier interpersonal skills. Psychodynamic therapy focuses on exploring the underlying conflicts and developmental deficits that contribute to narcissistic traits. Schema therapy integrates elements of cognitive behavioral, psychodynamic, and experiential therapies to address deeply ingrained patterns of thinking and behavior. Pharmacological treatments. Medication may be used to treat comorbid conditions, such as depression and anxiety, although no specific drugs are approved for NPD. Antidepressants, anxiolytics, and mood stabilizers may be prescribed to manage symptoms and improve overall functioning. Pharmacological treatment should be used in conjunction with psychotherapy to address the complex and multifaceted nature of NPD. Group therapy and support groups. Group settings can provide valuable feedback and support, helping individuals with NPD develop empathy and social skills. Group therapy allows narcissistic individuals to receive feedback from peers, increasing self-awareness and promoting healthier interpersonal interactions. Support groups can provide a sense of community and validation, reducing feelings of isolation and fostering personal growth. Challenges in treatment and prognosis. Narcissists' resistance to acknowledging their problems and their manipulative tendencies can hinder therapeutic progress. The grandiose self-image and need for control may lead to resistance, defensiveness, and disengagement from therapy. Long-term commitment and a tailored approach are often necessary for effective treatment. Building a strong therapeutic alliance, setting realistic goals, and addressing resistance are crucial components of successful treatment. 11. Case studies and clinical examples. Case studies offer valuable insights into the complexities of NPD, illustrating various aspects of the disorder and treatment approaches. Detailed case studies, real-life examples highlight the challenges and nuances of diagnosing and treating NPD. These case studies may include detailed descriptions of the individual's background, presenting symptoms, diagnostic process, and therapeutic interventions. Analyzing these cases provides a deeper understanding of the factors contributing to NPD and the outcomes of different treatment approaches. Analysis of treatment outcomes. Examining the successes and setbacks in treating NPD can provide guidance for clinicians and highlight areas for improvement in therapeutic approaches. Understanding the factors that contribute to positive outcomes, such as the therapeutic alliance, treatment adherence, and individualized interventions, can inform best practices and enhance treatment efficacy. 12. Current research and future directions. Ongoing research continues to expand our understanding of NPD, uncovering new insights and informing future directions. Recent advances in understanding NPD, studies on the genetic, neurobiological, and psychosocial aspects of NPD are uncovering new insights into its development and maintenance. Advances in neuroimaging, genetics, and psychopharmacology are shedding light on the underlying mechanisms of NPD and identifying potential biomarkers for diagnosis and treatment. Research on the role of early life experiences, parenting styles, and environmental factors is providing a more comprehensive understanding of the etiology of NPD. Gaps in current knowledge. Despite progress, many questions remain unanswered, particularly regarding the best approaches to treatment and the long-term outcomes for individuals with NPD. Further research is needed to develop more effective interventions, identify early risk factors, and understand the impact of cultural and technological changes on narcissistic behavior. Addressing these gaps in knowledge is essential for advancing the field and improving outcomes for individuals with NPD. Promising areas for future research. Future research may focus on developing more effective treatments, understanding the impact of cultural and technological changes, and exploring the potential benefits of early intervention and prevention strategies. Investigating the role of resilience, social support, and adaptive coping strategies in mitigating the negative impact of narcissistic traits can provide valuable insights for developing holistic and individualized treatment approaches. 13. Societal perceptions and misconceptions. Societal attitudes toward narcissism are often shaped by media and cultural narratives, influencing public perception and stigmatization. Media portrayal of narcissism. Media often sensationalizes narcissistic behavior, contributing to stereotypes and misconceptions. Portrayals of narcissists in movies, television shows, and social media can reinforce negative stereotypes and exacerbate stigma. Understanding the impact of media representation is crucial for addressing misconceptions and promoting accurate and empathetic portrayals of NPD. Common misconceptions and stigmatization. Misunderstanding NPD can lead to stigma, hindering efforts to seek help and support. Common misconceptions include viewing narcissism as merely a personality trait rather than a complex mental health disorder. Reducing stigma through education, awareness campaigns, and accurate information can encourage individuals with NPD to seek treatment and support. Advocacy and public awareness. Raising awareness about NPD and promoting empathy and understanding can help reduce stigma and improve outcomes for those affected. Advocacy efforts may include public education campaigns, support groups, and collaborations with mental health organizations to provide resources and support for individuals with NPD and their families. Promoting a more nuanced and compassionate understanding of NPD is essential for fostering a supportive and inclusive society. 14. Conclusion. In conclusion, narcissistic personality disorder is a complex and multifaceted condition that requires a nuanced understanding. By exploring its historical background, theoretical foundations, diagnostic criteria, etiology, treatment options, and societal implications, we gain a comprehensive view of NPD and its impact on individuals and society. Continued research and public awareness are essential in addressing the challenges associated with NPD and supporting those affected in leading healthier, more fulfilling lives. Through a holistic approach that integrates psychotherapeutic, pharmacological, and societal interventions, we can improve the outcomes and quality of life for individuals with NPD and their loved ones. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.